Good morning, Charlie. Good to see folks. Welcome to the Data Research Week here on the 9:30 call. Not by intention, but sometimes it just works out that way. It's good to see folks. We'll give it a few minutes as folks are joining from the waiting room. And Charlie, you should be set to share your screen when we get started. Good morning, Harold. I don't know if folks saw the commissioner's message before the Thanksgiving break. She mentioned her visit to Paula and Harold's, to Paula's barn. Did you know that
That's
was going to
correct.
happen?
No, not at all. It was totally a surprise for us. We feel really grateful for that, especially because she mentioned the group of Spanish educators that we are trying to, help and put into a community. So it was really good. It was really good. We just were looking into I think Instagram, and Paula saw it, started crying right away. Imagine that. So it was really nice.
We'll put the link in chat so folks can see it as well.
Yeah.
Um, Excellent. Well, Charlie, why don't we get started? It's great to see you here. As I think we shared with you, our first question for the 9:30 call is for you to tell us a little bit about you and how you came to be in your current role, and then we'd be excited to hear more about the data quality campaign.
Absolutely. So thank you, Amy. And full disclosure, I have two monitors, so I'm kind of looking around today, but
Okay.
please bear with me. But yeah, thank you all for taking the time this morning. My name is Charlie Rosemond. I'm an advisor with the Data Quality Campaign. We're a national level advocacy nonprofit. And so my background is in public policy research. So I'm very much a quant. I enjoy working with data, and I enjoy using it to answer questions that are relevant to the public, to policy, and to practice as well. But over time, I think my interests and passions in my career have shifted away from actually doing research to building systems that facilitate research and creating more optimal conditions for research. So I am based in Chicago, Illinois, and spent a number of years supporting the building of early childhood data systems here in the state. Also supported a few in the city of Chicago. And that's really been my passion over time. It's been a niche, but it's my niche. And so now I started earlier this year with the data quality campaign and more of an advocacy role. So it's been a shift for me, but a worthwhile one in that I get to just get out there and talk to a bunch of folks about data and engage audiences like you all. So with that, I will go ahead and share my screen and we can get started.
Great. Thanks so much, Charlie. And then after your presentation, if you could send us the slides and we will post them in our follow-up folder for the 9:30 call materials.
Absolutely. All right. So I always try to start presentations with a question. And, we don't have a lot of time today, so I'm not going to dwell on this. But if folks could, in the chat, just what could you do if you had better early childhood data? And so better could be more data, could be more complete data, more accurate data. Early childhood in this case today, I'm talking primarily about programs and services that are touching kids and families birth to five. Some allowance for prenatal, some for kindergarten, but really I'd just love to hear from folks. What could you do if you had better early childhood data?
And folks can use chat or come live, whatever works best. We see budget better, plan better, sleep without worrying. Elizabeth Watts, program planning and funding.
Yeah, so I see those trickling in, and again, I'm a data guy. I love collecting more data, so I really appreciate folks indulging me today. But I will keep it moving, but come back to this question in a few moments. So suffice it to say, and I'm preaching to the choir here, the early childhood space faces a lot of challenges, and those challenges tend to translate to the data side as well. So my employer and I and many others, we would argue that folks deserve more value from their early childhood data and data systems. It could be families and their kids, educators and providers, policymakers, the public writ large. Folks simply deserve more value from these data. So as I mentioned, I work for the Data Quality Campaign. We are a national level advocacy nonprofit, and we advocate primarily at the state level, but sometimes at the federal level as well for policy change towards better data and data systems. And so basically, we're the folks who, we push for getting better data in the hands of those who need it when they need it, so they can make more informed decisions as they progress, from early childhood through K-12, higher education, and ultimately the workforce. So DQC itself, it's been around for about 20 years now, but really its focus has been on K-12. There's been a longstanding interest in more early childhood programs, but it's been relatively dormant. So much of the organization's work is focused on K-12, and then more recently, higher education and the workforce. But over the past year, with some nudging from partners and support from a generous funder, we are diving into early childhood with earnest. And so that effort's been informed by really two guiding questions. And they're really focused on, asking what's the value to states, but early childhood stakeholders in general of better connecting data, raising the quality of those data, and making, data more available and accessible for a variety of early childhood stakeholders. But then what's the value of connecting early childhood data with K-12, so we can understand that transition into kindergarten, so we can better understand longer term academic and life outcomes. So what's the value of connecting early childhood data with K-12 and other education and workforce data? So what's that look like? This past year is actually about 10 months, ended in October. We convened an advisory group of over 20 representatives from various national level partners. So, research institutions, implementation partners, various membership organizations, all bringing them together and just talking about what could be possible with better data. And so in the DQC parlance, those are what we call use cases. So we ended up with 3 use cases, which are, basically stories that folks can tell about what's possible with better early childhood data and data systems. So to circle back to that question from the start, we were basically asking, what could states do with better early childhood data? And so our 3 use cases ended up focusing primarily on families, providers, and policymakers. And so specifically, states could make accessing services easier for families. They could help reduce the reporting burden on providers. And they could also integrate the data that they have across services to inform their policy decision making. So with that, I will go through each of the 3 use cases, starting with the first. So making accessing services easier for families. All of DQC's use cases, we, create what we call these avatars, right? And so here we have Elise. She's a grandmother. She's seeking access to high quality services for her granddaughter. But, given the fragmented landscape out there, she just isn't sure where to start. States have data on these programs and services, but those data aren't necessarily integrated. They're not necessarily accessible and, available for folks like Elise. But by centralizing, these data, making them available via portals that can provide more current information on stuff like quality, availability, eligibility criteria, and also processes to enroll, states can make accessing services easier for families like Elise's. For each of our use cases, we identified a state exemplar. So in this case, South Carolina is really leading the way in this area with their first 5 SC portal. And so this is a centralized portal that serves as what they call it, a one-stop shop to identify, options for childcare, for other services in the vicinity of families, but also to facilitate those families applying for services. And really the huge win in South Carolina was that, there check your eligibility for over 40 services. So this was a huge win on the governance side in terms of like programmatic governance, but also data governance in terms of aligning definitions and various, processes to facilitate this one-stop shop aspect and enable folks to, apply, enter their information once, and be able to, receive a determination, of eligibility across all of these services. So our second was reducing the reporting burden on providers. So, in general, it's a fragmented landscape. There's a bunch happening out there, and providers themselves are oftentimes facing administrative burdens in terms of reporting data up to these various state administrators. So, our second avatar, Allison, she runs a childcare center. It's in a mixed delivery environment, so she's offering several early childhood services to meet the needs of the families in her community. Different funders, different administrators, they each have their own reporting systems for data. So while Allison and her colleagues value data, they're overwhelmed by reporting it. And, oftentimes having to report it on the same kids multiple times across these different systems. So, we were thinking, how can states support Allison ease the burdens of reporting data, but also ensure that she and others are receiving actionable information back that they can use to improve their services. And so that is oftentimes through technology, but also alignment of systems and integrating data can streamline reporting processes, but again, reduce those reporting burdens. And so Iowa has made great strides in this area. So they've subsidized the use of childcare management software, CCMS, for providers. And so this is all about enabling more point-in-time data collection, but also streamlining data reporting as well for these providers. But I think more broadly, it's a huge win because it's helping raise data quality. So when folks are entering data maybe once per week or even maybe once per month, you tend to lose accuracy, and that tends to hinder data quality. And that's not, a critique at all of these providers who are wearing many hats and they're just inundated by any number of things, but including, the burdens of reporting data across these services. So how can states use technology to support providers and at the same time help raise data quality? So that's Iowa, and their Iowa Child Care Connect platform has been a huge win for them on a number of fronts. Which brings me to the third. So this is more of the classic data quality campaign use case in that it's integrating data to inform policymaking. But given the fragmented landscape, it's particularly necessary in early childhood. So Felipe is a state legislator, wants to better understand the reach and the impact of services in his district, so he can better assess, return on investment of various services. He is a legislator in relative power, but he just cannot access the data he needs to actually assess those investments. So how can states integrate data across services to, help Felipe and others make more informed policy decisions related to these services that are being offered, who's being served, and then, as I noted earlier, the later education and life outcomes of those children. And so a bunch of states, including Massachusetts, have really made strides in this area, and across all three of these use cases. But our exemplar in our report was the state of Virginia. And so their Link B5 system has been a huge win for them, and that has been built via strong partnerships both with the state agency, the primary state agency there in the state, but as well as a research university and a strong public-private, partnership there. And it's all about, aligning with programs, but also laying the foundation for connecting data within early childhood and then subsequently with K-12 and otherwise. So Link B5, it really grew out of the state's quality measurement and improvement system, or quality rating, QRAS. But it's grown quite a bit, and Virginia has really put a lot of investment into building out capacity to support this system. Which brings us to recommendations. So in our use cases report, we make a number of recommendations for state, both specific to each of the use cases, but broadly as well. And so these are just a handful of them, but I think really always starting with questions. Like, what are the questions that folks have that they've not been able to answer? They don't have the data to answer them. And so how can states engage a variety of stakeholders, policymakers, but also, providers, community leaders, researchers, others, and starting to ask and answer those questions, which leads to those next two. How can, states ensure that investments at the state level are being felt more locally? And part of that is public engagement, just keeping folks up to speed on what's happening. But I'd argue maybe the more important is localizing data. So, are data available at a county, a town level? Are those data relevant to folks? Are they timely? Are they actionable? If states are investing in state level infrastructure, but they're not able to localize those data, I think that they're missing out on some big opportunities. And that aligns with that third as well, in that how can states support more local folks in building the infrastructure, whether those are like data products, like dashboards, or otherwise, but I'd argue more importantly, building out the capacity to use data. So, building familiarity, growing those, cultures of data access and use, so we can ensure that folks have the data they need when they need it, again, to make more informed decisions. And, the fourth, like, folks are inundated with data. Arguably, there's too much data, but like, do they trust it? Are those data high quality? Again, are they timely? Are they relevant? If they're not, folks aren't going to trust the data, and they're going to check out. So how can states work to build that trust by ensuring that the data that are being collected, reported upward, and then made available back to stakeholders are of sufficiently high quality for folks? So that's kind of the more meta overarching. But without high quality data, it's in our name, the data quality campaign. A lot of this broader work is for naught. So I am leaving time for I'm not that hopefully someone's been monitoring the chat, but get to some questions soon. But next steps. So, this is one venue, but I am in the midst of a roadshow with these use cases across states, just engaging a variety of folks at the state level, more local level, presenting at various conferences and meetings. And DQC, a lot of what we do is creating materials and resources that help support data-related conversations. So we are diving into early childhood there as well. But it's really all towards making connections to encourage advocacy at the state level, policy change towards better data and data systems, and ultimately the implementation of these systems as well. Because you can have, a really strong advocacy campaign, a really well-written and thorough piece of legislation, but ultimately, if it's passed, now what? What are we doing? Implementation matters. So how can we ensure that, these systems are being built and of use for folks? So yeah, thank you. That was a whirlwind overview. Happy to share the report. I can find the report and share it in the chat as well. But please reach out. There's my email. Always happy to chat about data. Again, a lot of what we do is at the state level, but I have a background in more local level data and engagement as well. So always happy to chat if folks have questions or just want to learn more.
So we do
Yeah.
have some questions in the chat, plus a few more, and we'll send you the chat, Charlie, so you can see
Mhm.
kind of folks what their response to the first question was. Thank you for this information. When you mentioned providers, could you clarify if family child care providers were included in the research or the data collection process?
Absolutely. Yeah, it's a great question. So in general, like family childcare, it's a bit more difficult always. So, you're thinking about school-based settings, center-based, thinking about more homes. So family childcare tends to be more difficult to get data in those areas. And, it's a struggle in general. But from our perspective at DQC with these use cases, definitely included more family childcare and home-based providers as well. But that's with the caveat that those more home-based settings, oftentimes more informal settings, it's just a challenge collecting data from those folks in general. If there are like licensing requirements or otherwise, it's just a struggle for states to collect those data. But in terms of like inclusion in these use cases and our recommendations, absolutely.
And then what sources of funding are being leveraged to build these system, or what is typical federal, state, philanthropy, or all of the above?
Yeah, another great question. So it's interesting. It's kind of shifted over time. So over the past 10, 15 years, there have been various federal grants that states have leveraged to help build out these systems. Um, here, to and through the COVID pandemic. There were relief dollars that states have started to leverage. But, it's really shifting over time away from like more federal grants towards state funds, state appropriations, and also some philanthropy as well. So it really has been a combination. But I would say over time, I think it has shifted more away from federal sources and more towards more state and philanthropic ones.
That's great. Thanks for the information. For the Felipe example, it would be great to get an answer to what is the return on investment in early childhood education with the data system Virginia has built. If so, can you go one level deeper and explain how the system enables um that or what indicators he has access to that he can attempt to answer that. So basically, like, and we've seen this, right? Like a legislator might hear something, and then like you know, where do they go to get the information in Virginia? Like, are they doing dashboards or things like that?
Absolutely. Yeah. So my understanding is that a lot of it, so there's a lot of back and forth in budgeting processes in general. And a
Right,
lot of it is having more timely data to inform that budgetary iteration. So, if the legislature, a governor's office, if they have questions, the state agency is in position with these data systems to provide, accurate and timely data to the folks who are creating these budgets. So in the case of Felipe, a contrived example, but that could be just like more of a fact sheet. It could be access to a dashboard, perhaps public facing, or with um, a few additional permissions. But I think it's really more the timeliness of data for folks as, a legislator like Felipe or other policymakers, like, do they have that data when they need it
right.
to inform like budgetary conversations or others? But yeah, so in Virginia, can't really speak to specifics, but really just informing budget conversations has been a huge win for them.
And I think, yesterday we heard about like workforce registries, and we know that states collect data in different ways. We know there are different definitions. We know there are different governance structures. And so I think kind of where you sit as you think about all these, different systems, and we know it can be hard to compare apples to apples in that, Can you talk a little bit about that process? How do you go about that? You know, do you have kind of templates or best recommendations for best data?
Yeah, short answer, yes. Yes.
Okay.
So, yeah, no, it's a great question. So DQC, we've been in this space for a while, relatively new to early childhood, but a lot of experience with like state data systems in general. So we have a bunch of resources on just with, Data 101 is an example. So we have resources to kind of get more folks more comfortable talking about data and using data. Um, but we have like in-person workshops, others to talk through topics of like data governance, data integration, data communications, and otherwise. So we have a bunch of resources on that front. But yeah, it's an evergreen challenge in this fragmented space. I mean, early childhood is pretty fragmented. So when you have like a state education agency has state funded pre-K. You may have another agency that has like CCDF, childcare subsidy, Head Start data have kind of been a unicorn given, the direct to local grantee structure. It's a real governance challenge on the program side, but also the data governance side. So yeah, DQC has resources on that front. A lot of states are encountering similar challenges, and I think a lot of our role, or at least our hope for entering this space is, setting tables for different states to come together and, share some of their own challenges, share how they're addressing them, and, hopefully share learnings across states.
And then maybe a word about kind of unique identifiers, especially when you think about kind of the K-12 data system, so much of that when you can kind of, when you can have that data on an individual child. Where have you seen kind of promising practices for early ed and with unique identifiers? Or have you?
Absolutely. Yeah, definitely have, but here again, it's a challenge given all of these different services and the data residing in different places. But where these systems have succeeded, it's in states that have established that unique identifier across these services. And so that facilitates linkage of data. It facilitates, ultimately answering some of those like policy and research questions and that, what are the effects of XYZ interventions 4 or 5 years down the road. So using those unique IDs, you can understand more longitudinally how kids are doing and how they've been interacting with systems. But yeah, I would argue establishing a unique ID across services is necessary, it's vital, and it can be a real boon to the work when it's done. And it's a technical process, but I'd argue it's more of a governance one and just getting folks to the
Right.
table and making data available and accessible to then integrate, to then establish an ID, and then to make those IDs available to inform research and other analyses.
And then the last question, does your research include grant funding use? So Massachusetts has pioneered this with continuing C3. So we have our state has, taken over the ARPA dollars, 475 million. So with the grant comes some data reporting requirements. Have you seen that in other states? What does that look like?
In terms of states taking over those
Oh,
dollars,
oh no, we know we're like
yeah,
we're the only
absolutely.
one. But this
Huge
idea of
win.
like you get a grant, so then the because now we have real-time data from all like
Mm,
most 90% of providers in Massachusetts. So kind of
right.
using grants as an incentive for data collection.
Absolutely. Yeah. So, what those incentives are and like how successful they are in different states. I mean, it'll certainly vary.
Right,
But can states subsidize use of childcare management software? Can they, through relatively straightforward, hopefully not onerous, like licensing requirements, add a bit more teeth to the collection of data from various providers?
right.
And sometimes that is through grants, through those subsidies, otherwise. But yeah, I think. I don't have immediate examples off the top of my head, but states are getting creative in that space, just given, scarcity of resources.
Right. Well, Charlie, thank you so much for joining us. We had like over 70 people on this morning to hear the presentation. And yes, if you can send the slides and with the invitation for this week, we had your link. But so any other information that would be helpful. And please come back anytime to the 9:30 call. We'd love to have you and just really appreciate the work and the focus on early ed at Data Quality Campaign. So thanks so much for joining us.
Thanks, Amy.
All
Take
right,
good
take
care.
care. Have a great day, everybody. We will see you tomorrow morning at 9:30, where we will hear from the Rennie Center and with highlights on the report from the event a few weeks back at the Boston Foundation. So have a great day and see you then.